Tuna is often perceived as a safe or even ideal protein because it is lean, widely available, and commonly recommended for heart health. But for people with gout or chronically elevated uric acid, it deserves much more caution than it usually gets. Depending on the species, cut, and processing method, tuna frequently falls into the moderate to high purine range, meaning it can significantly contribute to uric acid production when eaten regularly or in large portions. This is particularly relevant for canned tuna, which is often consumed more frequently than fresh fish and sometimes in larger cumulative amounts across the week. Repeated exposure to these purine loads can keep uric acid levels persistently elevated, increasing the likelihood of silent crystal deposition in joints and tissues even when acute gout attacks are not immediately obvious. One of the hidden risks with tuna is how easily it becomes a routine food. Unlike richer fish that people eat occasionally, tuna is often used daily in sandwiches, salads, rice bowls, or as a quick protein source. This habitual intake can quietly undermine urate control over time. For individuals prone to gout, the issue is not just a single meal triggering a flare, but the cumulative metabolic stress of repeated purine intake that the kidneys must continuously clear. Many people with gout already have reduced renal uric acid excretion, sometimes due to genetics, aging, insulin resistance, hypertension, or mild kidney impairment. Adding tuna frequently to the diet increases the workload on this already strained system, raising the risk of gradual uric acid accumulation and more frequent or severe flares down the line. Processing also matters. Some canned tuna preparations may concentrate purines differently than fresh cuts, and they are often packaged in brine or oil with added sodium. High sodium intake can worsen blood pressure and kidney stress, indirectly impairing uric acid clearance. In addition, tuna salads are commonly paired with refined carbohydrates, sugary sauces, or alcohol-containing meals, all of which can further amplify uric acid production or reduce excretion. These combinations make tuna more problematic in real-world eating patterns than it appears when viewed in isolation. There are also broader health considerations that intersect with gout risk. Tuna, especially larger species, can contain significant amounts of mercury. While this is not directly related to uric acid, chronic mercury exposure can affect kidney function and overall metabolic health, indirectly complicating urate regulation. For people already managing gout, adding another potential renal or inflammatory stressor is not ideal. Furthermore, while tuna does contain omega-3 fatty acids, the amounts are generally lower than in smaller oily fish, and the anti-inflammatory benefit may not be enough to counterbalance the purine burden in gout-prone individuals. From a nutritional standpoint, tuna does provide high-quality protein and useful nutrients, but these benefits are not unique to tuna and can be obtained from safer alternatives. Eggs, low-fat dairy, tofu, legumes, and lower purine fish such as cod, sole, or haddock can meet protein needs with far less risk of destabilizing uric acid levels. Even among fish, rotating different types and limiting portion sizes is far safer than relying on tuna as a dietary staple. For people with frequent gout flares or persistently high uric acid, tuna should be treated as an occasional food rather than a default protein. Portion size matters. Even moderate servings can be too much if eaten several times per week. During active gout flares, tuna is best avoided altogether, as it may prolong inflammation or trigger additional attacks. Long-term gout management is not only about avoiding dramatic flare triggers, but about minimizing repeated, moderate stressors that slowly push uric acid upward. In that context, tuna sits in an uncomfortable middle ground, nutritious, but risky enough that regular consumption can quietly sabotage urate control if caution is not exercised.